Hello everyone, I am Shivashankari working as a nursing tutor in Sri Shanmuga College of Nursing for Women. I have to discuss about administration of oral medication. Mm, First one objectives. In objectives, what and all we have to see means introduction, definition, rights, nurses' responsibilities, demonstrate and safe administration, maintain efficiency of administration. These are all the things we have to see. Next, introduction. Introduction. Oral medication is the most commonly used route of drug administration. Drugs are taken through the mouth, available in various dosage forms, and it is a easy, safe, and convenient for patients also. Next one is definition. Definition. Oral medication administration is the process of giving medicines through the mouth. The drug is swallowed and absorbed through the gastrointestinal tract to produce a therapeutic effect. Next one is purpose. To treat and manage illnesses, to relieve symptoms such as pain, fever, or infections, to maintain therapeutic drug levels in the body, to promote recovery and improve patients' health, to prevent disease or complications, to provide long-term treatment safely and conveniently. Next one, rights of medicine administration. What are all the rights we have seen means patient, right medication, right dose, right route, right time, right documentation, right reason, right response. Right patient means we have to check patient ID, patient ID band and patient drug chart and patient file. These three things we have to check. After that, identify the correct patient. After, we have to administer the medicines and all. Next, dose. What are the dose doctor prescribed? That only we have to give. Route also. What is the route written? That only we have to give. Next, timing. Timing is the most and most important because of to reduce the infections, to reduce the disease and all. While we administer medication as timing, patient will recover easily and fastly. Next one is documentation. Documentation is the prior, it is a legal thing. We have to follow that. That one is important. Next, requirements. Prescribed medications. What are the medications they are all prescribed, we have to administer that one. Next one, medication tray, clean drinking water, medication cup or spoon, gloves if required, patient medication chart, scissor, pen, drug chart, medication crusher, that is most important. Ounce glass for liquid medications and all we have to measure. Example, syrup and all we give in ounce glass only. Next one, procedure. Perform hand hygiene. Verify the medication order. Identify the patient correctly. That is the most important. Identify the patient is most important. After that only we have to give the medicines and all. Next one, check medication label, dose and expiry date. This is most and most important. You have to check medication label and all. Next, dosage and expiry date and all you have to check. Prepare the correct dose for the patient. Position the patient in a sitting or upright position. Explain the procedure to the patients. Give the medication with sufficient water. Next one is ensure the patient swallow the medication. We have to check if whether we give the medicines to the patient. We have once verify if patient will swallow that medicines or split it out. We have to check and verified once. Don't leave the patient unattended. We don't leave the patient unattendedly. So we have to with the patient after that patient administer the medicine, then only we leave the patient. Next one is dispose of used items safely. We have to dispose what are the items should be used, disposed as per the biomedical waste management. We have to segregate the waste and discard it. And after that, we have to perform hand hygiene. Next one is document the medication administration. After hand hygiene, we have to document the medicine. What and all we have to document means drug name already written. In drug, we have put our signature due to the we administer the medicines or not. We will put a signature means that time we identify that time the nurse should administer the medicines. This is the documentation that is most important. After administer the medication only we have to put a signature in the drug chart. Otherwise we will not fake entry in the documentation. This is the most important because of I already said it is a legal documentation, so that's why we have to check everything on that. Next one, observe the patient for any adverse reaction. We have to observe the patient for adverse reaction. For if patient had any allergy reactions means we have to inform ward in charges and consultant doctor. After that, a clinical pharmacist. Clinical pharmacist is a major role because of they written a ADR form. So that's adverse drug reaction form they will taken. If patient had any allergy means they cross check the patient, they cross check the medicines, everything they check, and after that we have to give the treatment for patient. So that's why we have to inform the clinical pharmacist. It is the most important in this. Next one is nurse's responsibility. In nurse's responsibility, what and all we have to see means hand hygiene before drug administration. In everything we have to administer the before administer the medication we have to do hand hygiene. Ensure the patient in sitting up whenever possible to facilitate swallowing. Whether we administer the oral medication means patient will sit upright position, then only you have to give the medicines. Otherwise it will patient will while swallowing means that time patient can't able to swallow, so that's why patient had a difficult, so that's why we have to sit a patient in upright position for swallowing easily. Ensure patient take the medicine. We have to check patient will take the medicine and all. Observe for any adverse reaction for medication. If patient had any adverse reaction after administration, we have to notify that. If there is no means no problem. If there is a problem means we have to notify to the physician and clinical pharmacist. Next, mm, if patient have any allergy reactions immediately inform. I already said that point, that only written in there. Clinical pharmacist we have to inform for ADR form, they will reconsolidate everything, they will written and document it and report it, so that's why you have to inform to them. Next one is what are the mild some pictures only I shown. Mild allergic reactions like rhinitis will happen, skin rashes, pruritus, next angioedema. These are all the common signs and symptoms. If patient had any allergy reactions, these are the signs will happen for patients. Next, what and all things we do's and don'ts, that and all added. Do's, first and all, what and all we do, verify the medication order, right patient, drug, dose, route, time and all. Next, check patient identity using at least 2 identifiers. Next one is confirm allergies before administration. If patient had any allergy reactions means we have already written in a red pen in drug chart itself for administering for cross check for the allergy reactions. So that's if patient had any allergy means, if patient example patient had an allergy reaction of paracetamol means we don't give that and all. If we specify in red pen in a drug chart itself, everybody know patient had an allergy of paracetamol, so that's why we don't give we don't administer paracetamol combinations and all. Alternative drug we have to administer. These are the things to confirm allergies. Next one is wash hand. Wash hand before administration, hand wash is must. Next, explain the medicine to the patients. We have to explain the medicines, not the medicine and all. Explain what and all we do patient side itself. We have to explain everything to the patient because that is a patient will not fear during administration of medicine and all. So that's why we have to explain everything to the patient with clearly and correctly. Next, ensure the patient is upright position, sitting or semi-fowler to prevent. That's why to prevent aspiration, we have to ensure patient in sitting or semi-fowlers. Give with appropriate fluid unless contraindicated. Next, check expiration date and all. If patient, we have to check any expiry is there. If a short expiry is there, means we will change expiry in pharmacy. After that, we have to give. Or else, if patient medicine is expiry, means we don't give that and all. So that's why we have to check once expiration date. Next, use proper measuring devices for, or like syrups and all. We have to measure and give. Observe the patient swallowing the medicine. We have to notify patient will, whether the patient will swallow or not. Next, documentation. Monitor any adverse reaction. These are all the things we have to do. Next, don't. What and all we don't do. That means do not administer without a valid order. Next, do not give medication if the patient questions if very first. Don't crush or split tablet unless confirmed safe. Do not mix medication with food or drink unless approved. Do not leave medication unattended at the bedside. Next, do not administer to a patient who is vomiting, unconsciousness, or unable to swallow without medical guidance. Next, do not use household spoons to measure liquid medications. Next, do not administer expired or damaged medications. Next, do not crush or break down the capsules format. Next one is do not forget to document or delayed documentation. Next one is summary. Oral medication is a safe and common method of drug administration. Following correct procedure and medication rights ensure patient safety. Proper documentation and observations are essential. These are all the things we have seen in oral medication administration. Thank you.